Hi there, here is our presentation on autism. Autism is a brain disorder that can complicate communication with others. Autism affects many different areas of the brain, and it can also affect communication, social, and behavioral aspects of life. Doctors have found that autism is not directly targeted by one specific thing. Neurodevelopmental abnormalities have been found to play a role in autism, which will affect the social communication and may cause behavioral problems in a child. The genetic etiology of autism can be associated with genetic and non-genetic factors. The non-genetic factors of autism can be called environmental, and they include maternal age, maternal diabetes, and infection contracted during pregnancy. Some recent claims have been trying to pin autism on childhood vaccines. If a sibling has an autistic disorder, it may be present in other children as well. Genetic factors include the following medical conditions, such as tuberous sclerosis, Fragile X syndrome, maternal rubella, or Angelman syndrome. This disorder usually presents itself around the ages of 1 year to 18 months of age. Each child should meet milestones, and these milestones are checked at wellness exams performed by a physician. One of the main reasons a parent gets concerned with the development of the child is if the child has not started talking by the age of 3. Some children may begin to talk, but then also lose their language skills later on. There's no set clinical manifestation for autism because there is such a wide variety of behaviors. Some examples of behaviors that could be a sign of autism are body rocking, attachment to objects, and getting upset with changes. These can be classified as mild to severe. Many children with autism have below normal intelligence. This factor can separate them from the average child and create communication boundaries. As a child ages, other problems that can arise are anxiety, depression, and learning habits. If an autistic child is above the average intelligence, then anxiety and depression are more common. Another characteristic of an above intelligence autistic child is to endanger animals at a young age. Some things that may help diagnose if the patient has autism or other physical issues causing the symptoms would be a physical exam, a hearing test, and lab tests. When physically assessing a child who is suspected to have this disorder, the nurse will want to include the head circumference, the height of the person, and the weight and compare it to a typical growth pattern. A hearing test is used to rule out hearing issues which could be causing the decreased speech development. Fragile X syndrome needs to be ruled out by looking at chromosomal analysis, and this is done if there is any intellectual disability or any history of disability in the family. Fragile X syndrome causes below normal issues with the person's intellectual ability and can cause behaviors that resemble autism. When discussing the duration of autism, it is a disorder that the person will have from diagnosis, which is usually within the first few years of age, and continue to have throughout their entire life. Every person's disorder will progress differently, and some people suffer from worsening of symptoms, and others have less severe symptoms as it progresses throughout their life. Those who will show less severe symptoms and possible improvement over time will be those who have higher intellectual abilities in comparison to those who may have an decreased intellectual ability. Within a child's first year, there are some signs that the parents can look for if they suspect that they may suffer from autism, which include not socializing with others, no hand movements such as waving or clapping, and not liking to be held or cuddled. When they turn age 2 and go through their second year, this disorder becomes more apparent than it did previously. If the child has a lack of interest in playing with others, or is not speaking or using small words or phrases, or if they have behaviors that are repetitive such as rocking back and forth, these are indicators that the child may have this disorder, and the parent should discuss these with their doctor. As the patient gets older, a parent may notice their child will continue to have these repetitive movements along with having decreased speech development. A key thing to remember when it comes to autism is that the earlier that the parent's concerns are taken to the physician, the treatment is more effective. With each individual, the outcome and what is expected of them will differ depending greatly on how severe their disorder is. Since each person is different, so is the outcome, but there are some indicators one can look at to see how that specific person's disorder will affect them. If a child develops their speech before they turn 6 years old and possess a normal IQ, then here are some things that doctors and parents can expect. 20% of patients will have very independent lifestyles and a job. 20% will have mild independence but need family support for certain things, and then 60% will need high levels of support and care throughout their daily life. The life expectancy for a person with autism does not differ from those without this disability. Dependent on their intellectual ability, they may be more prone to life-threatening accidents such as drowning, so accident prevention is important for the caregivers to know. Some pharmacological measures that can help people with autism function better by managing their high energy levels, inability to focus, depression, or seizures are selective serotonin reuptake inhibitors, which can be used to help with depression, anxiety, and obsessive behaviors, antipsychotic medications that can be used to treat patients who exhibit behavioral problems such as self-injurious behavior, tantrums, or aggression. It is important to remember that these medications will not affect all autism patients the same way. Healthcare professionals and parents should monitor the child's progress and reactions while he or she is taking the medication for any negative side effects. Early intervention services such as therapy to help the child talk, walk, and interact with others can all greatly improve development and help the child learn important skills. Applied Behavioral Analyst (ABA) is a well-known treatment approach for people with autism, and its main goal is to boost positive behaviors and discourage negative behaviors in order to improve a variety of skills. Occupational therapy works to promote, maintain, and develop the skills to help the person with autism live independently as possible. Sensory integration therapy helps the person with autism cope with sensory information like sights, sounds, and smells. This can help someone who cannot tolerate certain sounds or does not like to be touched.